curves around. This is the popliteus. This muscle that curves around right here on the knee is the popliteus. Right in the back of the knee pit there is the popliteus. Curves right around there. It's the popliteus there. Okay, now the three that I just added. Well, okay, first off, to position us again, we have the Fibularis Longus running along the fibula here. Now on the back of the leg, we have, first off, this big giant beefy muscle. See this big giant thing right in the back of the leg there? This is going to be the Flexor Hallucis Longus. Flexor Hallucis Longus, it's on the medial side of the leg. Flexor Hallucis Longus, this big giant one here. And then we have the Flexor Digitorum, is this guy here. Flexor Digitorum is the more, or excuse me, Flexor Hallucis is on the lateral side, Flexor Digitorum is on the medial side. Flexor Digitorum is the medial most, Flexor Hallucis is this big one in the back. Between them, there's a little wedge, that's the tibialis posterior. Tibialis posterior is just this little wedge right in between the two. Little wedge of tibialis posterior. Now, one thing I just like to remember that helps me identify these guys in the back. The big beefy one is going to be the Flexor Hallucis Longus. Flexor Hallucis goes to the hallux, the big toe. The reason why it's so big and beefy is because when you take a step, don't you push off with your big toe? Every time you take a step, you push with your big toe, so you need a nice big muscle to contract and allow you to push with your big toe there. So that's why the Flexor Hallucis is so big. It's also more laterally placed than the Flexor Digitorum because that angle that it gets off the toe coming in at the side, along the side there actually increases its flexion power. So it actually gives it a little bit more leverage to work with. So Flexor Hallucis, and then the Flexor Digitorum, and the tibialis posterior right there. Okay, and then of course we had the flexors retinaculum, extensor retinaculum, superior and inferior here on the front there, which we went over yesterday. Okay, but I think that's about it. Any questions there?